Medicine Then and Now. Chapter 5, Finding Cures. Since 1750, doctors have discovered cures for many diseases. They also have learned how to prevent some viruses and bacteria from making people ill. Vaccines in the past. Vaccines are medicines that teach a person's body how to stop a disease in the future. Smallpox is a disease that killed millions of people. In the past, doctors in Asia and Africa put smallpox scabs up a healthy person's nose to give them a weak smallpox disease. This worked as a vaccine on some people, but it killed others. In 1796, a British doctor called Edward Jenner made smallpox vaccines from cowpox, a disease that calves had. This vaccine stopped thousands of people dying from smallpox. Vaccines today. Today, doctors and nurses inject vaccines. They use a needle to put the vaccine into a person's arm or another part of their body. The vaccine is a weak type of virus or bacteria. When a vaccine is inside the body starts to make antibodies to attack vaccine. Antibodies are a substance in the blood that can kill viruses and bacteria. When body has learned how to make the antibodies, they're ready to kill viruses or bacteria when they're getting inside the body. This prevents the person getting the disease in the future. Bacteria and disease. In 1864, a French scientist called Louis Pasteur discovered that bacteria in the air could cause diseases. Then he had an idea that you could prevent disease by stopping bacteria getting into your body. A British surgeon called Joseph Lister used Louis Pasteur's ideas to make the first antibiotics. Antibiotics are the substance that could kill bacteria. Tools used in the surgery, they also kill bacteria that can make wounds from becoming infected. This stops many people dying after they had surgery. Discover. When we touch things, we get bacteria on our hands. That can make us ill. The best way to prevent infections is to wash our hands often. Penicillin. Penicillin was the world's first antibiotic. Antibiotics are drugs that can cure illness caused by bacteria. Before penicillin, people could die from a small wound in their skin if bacteria make the wound become infected. Alexander Fleming discovered penicillin in 1928, but other two scientists, Holly Ford and Ernest Challen, tasted penicillin to find out if it was safe to use. They also made penicillin that could inject. Penicillin helped thousands of wounded soldiers during World War XII. Between 1939 and 1945, since that time, Helston has saved the lives of millions of people.